So good afternoon, everyone, and welcome to your Nclex orientation. This will be Group 6, and this is courtesy of Phoenix Occupational Health Solutions, where we believe in transformation through education. Sorry about that, 2023. So basically, this company was established in 2020. We do BLS, which is basic life support, and advanced coronary life support with the AHA. We do first aid and CPR for non-healthcare workers. And I also teach ECG, arrhythmias, and interpretation, as well as the NCLEX preparation. My name is Miranda Ramjatan, and I'm a registered nurse. I currently work at Southwest Regional Health Authority. I am emergency and ICU trained, also a trained preceptor and a trainer for the customer service workshop at Southwest. I am an AHA instructor for both basic life support and advanced coronary life support. I currently work as a district health visitor with Southwest, and I have a master's in public health. So this is what I look like. I'd have to come back out and show you what I actually look like after work, but this is the pretty version of me for those of you who don't know me. Okay? So one of the biggest questions that people ask is, what is Nclex going to cost me? Because when we go with the agencies cover everything. So doing Nclex basically with we're not going to do IELTS unless they ask us. Most of my students have not had to do it. All right, so that's a 2,000 that is not going to be paid for. IELTS is your English speaking test. All right, sometimes the board requests it. Your first fee would be your tuition fee, which is $4,000, and your registration $500. Your registration fee would include me doing all your paperwork for you for CGFNS and for the nursing board, your fingerprints, as well as for Pearson VUE. So all you have to do is pay your fees and study. Right, so these are your first two fees, 4,000 TT for tuition and 500 TT for registration fees. The next cost that you will incur would be the $485 US. This is to be paid via a credit card to CGFNS. If you don't have a credit card, don't worry, pay it to me in TT and I will pay it for you. After that, you have to pay, I think the fee now is $750. You have to pay $250 for your license verification, and you have to send off your consent form, as well as to pay. You can choose to pay to send a DHL, or you could just send it registered mail. If you send in a DHL, it's an additional $410, which is included in the $710 and $750. Okay, your transcript, I think they dropped the price now. It's approximately $5 to send it off because they're not sending a physical copy, they're sending an electronic copy. So it's 15 US. I have to update this. Then your fingerprint screens, I would have told some of you all who I had the opportunity to speak to. We're using the New Mexico State Board. We're not using Illinois because they're very difficult to contact. You have to be up at 2 a.m. because a lot of the foreign nurses are using Illinois. And you have to stay up till 2 a.m. to be able to access their website. Plus, if you have to call them about any queries, they never answer their phone. So I am registered with New Mexico State Board, and it's part of the compact state. So when you go across, you could just apply for your compact state license when the agency is sponsoring you. The Nclex exam, sorry, your fingerprint cards, you would have to send off your fingerprint cards to get the FBI to fingerprint you. So the screen is about $44 US. They will, the New Mexico Board of Nursing will mail you the fingerprint cards, or you can buy it on Amazon. And then just take it to the police station. You're not going to pay for a CFC. You're just going to take the cards to them and say, I need to get my fingerprints done to be sent abroad. And there's no cost to that. All right. However, you still have to make the appointment in some police stations, even though they have this banded that some police stations still stick to the appointment system. All right. So you're not paying for the CFC, you're just doing the appointment and taking your fingerprint card from the FBI to get it done. And then you're going to mail it to the address given. All right. We pay this with credit card as well. The next fee would be 150 US, which is paid to the nursing board, and this is to apply for your registration fees. All right, but you don't do this on these two fees, the 44 US and the 150 US. We don't pay this until Nursing Council has sent off their license verification, because they take 3 to 4 months. Some people take 6 months, and this has a deadline of 1 year. So we're going to make sure that Nursing Council send off their paperwork to CGFNS, and then we're going to go in and pay these fees, right? When we do the CGFNS fee, that is to get your credential evaluation service, stating that your license has been verified, and your transcript would be sent verifying that you did a certain number of hours and it is acceptable based on US standards. After the fingerprints have been verified, the Nursing Council will say, okay, you have your authorization to test. So we go into Pearson View and we pay 200 US, and this is for your Nclex exam. All right. Flights, when I did this, was basically 5,000 TT. So we're looking at a total of 879 US or 11,500 TT, but we have to minus the 2,000 here because we're not taking that into for the IELTS. All right. So basically, you're going to be investing around 10,000 TT in yourself in order to move on to Nclex. Any questions so far?
No questions.
Okay. So what exactly is our plan? So our plan is that we give you learning materials every week. It will be given in a PDF form, and you're required to study materials. It will be presented in the class, and you are required to do the quiz on the material. Every week we do a particular topic. Once we finish that particular topic, you'll be sent question on a Google Doc, right? With the questions, it is part of the learning material. It is not a test. It is not an assessment. I might use the word assessment if it slips my mind or my tongue, but it is part of the learning material because you're learning how to answer the questions. We have an entire class based on strategies on how to answer Nclex questions. Even if you don't know the answer, how to evaluate the question to come up with a sensible answer. All right. So you are required, when you get the materials, to go through it. The video would be available to you via the YouTube channel, and you are required to answer the questions. For those of you, I know you're working and you have your family, but you're investing in yourself, do not leave Nclex to do it on your own time. It is a comprehensive package that helps you through repetition and questions and material to help you pass the exam. Because I had one person and I was coaching her very closely, and she did not do all the questions. Every time I spoke to her, she was tired. We are all going to be tired, but it's mandatory that you answer your question. It's going to be beneficial for you if you want to pass NCLEX on your first try. Okay? So most of the materials, again, will be given in a lecture discussion. Sometimes we will switch it up. I will send you the lecture because it might be very long. So instead of keeping you for 4 hours, it might be pre-recorded from another class. I will send it to you, and then we could do the questions in class. All right, based on you studying the material that I would have sent. You are always encouraged to ask questions. I like the class to be as interactive as possible. With each topic that we do on a particular day, there are questions at the end of the class or in the middle of the class. So you are required to participate. There are no dumb questions. In my classroom, it's a safe classroom. We do not judge people. Everybody has different learning abilities and everybody has different styles of learning. So we have videos, we have the lecture, we have pictures. What I essentially do is I break everything down in a simple form for you. So instead of reading a whole paragraph, like say for instance, the endocrine system and the thyroid hormones, instead of you reading a whole paragraph, I'll make a flow diagram for you. I will break things down in tables. We also get things from tables from UWorld to make it easy for you to remember, and the cheat sheets from Simple Nursing. I'll show you one of the lesson plans in a little while. Any questions so far? Okay, so we'll move on. So this is basically the course outline that we're going to do. So we start off with your lab values and fluid and electrolytes. Yes, you do not get tested on lab values anymore, but you're going to be practicing in the US and you're going to have the new generation questions where they're going to give you the lab values and you have to know if it's normal or abnormal. All right, so there are certain things I would advise you to learn, such as your metabolic panel. When we go through the lesson plan, the first lesson plan that you have is what I call my cheat sheets. So you can start learning it off one time, right? So it have like your lab values, it have your different types of diet, it have the toxic levels of drugs that you need to know, as well as the therapeutic level. So all of those things you can start learning it up front. If you learn one thing per day, it's one more than you knew the day before. Okay, then we're going to do psychiatric conditions and their medication. We start off with this because this is one of the least amount of knowledge we have as a basic general nurse in Trinidad. Um, the antenatal delivery and fundamentals, we don't have a lot of practice in that because we just do like a 6-week or 8-week orientation or rotation through those departments. So we start off with psychiatric conditions. We don't really do pathophys so much. It's more the medication and its side effects and some communication, therapeutic communication that we look at when we are preparing for Nclex. We start this off so you have enough time to start learning it. And because the medications in psych is closely related to the medications in the neurosystem, we're going to follow that with the neurological system, which is a very difficult system for some people as well. So we start off with those two very difficult topics, and then you've had time, you will have all the time in the world to start learning it off because you have to know the drugs, the therapeutic levels, as well as the dangerous side effects. And then we start off with the fundamentals, such as your ethical, legal, your cultural differences, medication administration. When we finish with those fundamentals, we're going to start with the beginning family, and we're going to do antepartum. That is one lecture, might be divided into two. Labor and delivery, one lecture, and postpartum, another lecture. So that's 3 to 4 different days. With each section, you have questions that come based on the what Nclex is looking for and based on the material that you would have been taught. We would follow up the beginning family with the newborn, starting with newborn assessment, and we'll go through developmental milestones, their vital signs and play, as well as theories related to child development, such as Erikson and Piaget. After we finish the theories, we are going into the pediatric conditions, and we're going to cover each one. Some congenital and cardiac conditions, congenital and genetic cardiac conditions, the respiratory system, endocrine, renal, musculoskeletal, neurological, integumentary, and the GI system. Not necessarily in that order. It depends on how you all respond to the classes. So I tend to give like a hard topic and then an easy topic, a hard topic and then an easy topic, so you wouldn't get overwhelmed. We're going to follow that up with the adult conditions for these same systems and procedure and skills. I would tend to do this last now. So before I would do the med-surg conditions, after the procedure and skills, but we do the med-surg after the pediatric, and we will follow with procedure and skills. Simple things like putting on a glove, you can be tested on that. NG tube insertion, chest tube suctioning. We will cover it in the topics, and some we will do immediately after. And then we're going to be doing questions. We're going to the month before you write exams, and I'm hoping all of you move together as a team so that you will benefit of this 1 month of questions and answers, right? We're going to be doing it in a test form every week. I'm going to be sending you it, and at least 2 or 3 per week. You're going to be getting the links and you would have to do it. When you're preparing for your NCLEX, the month before your exam, you should be prepared to do 75 to 150 questions every single day, right? We're going to set up a timetable. You take 6 days and 1 day off. So you do questions for 6 days, you give your brain a day off, but you should build your mental discipline and your mental stamina to be able to answer 75 to 150 questions per day and go through the rationals if you want to be successful. For me personally, I did Nclex in 2022. But having been an ICU nurse and a trauma nurse and more or less kept in touch with all my practices, it wasn't too hard for me to do my exam, but I did focus. I did prepare like a month, getting all my materials in place, making my cheat sheets, making my short notes, at least a month, most of them. And then the month before my exam, I used my UWorld subscription and I did it twice. And that is what prepared me. When you do it the first time, you're still learning, you're still honing your knowledge, but the second time, you're perfecting it. All right, so be ready to do these questions twice. We will make up the same test. You would have access to it. I will open the portal for you, and then I'm going to make up mixed questions for you, just like a real test. Okay? So we discussed the cost already, and we're looking at tuition. The learning materials, you get the soft copy, the PDF, you can print it if you wish. And these are the four sources we use. We use questions from UWorld as well as their tables and their short notes. We have Mark K. Klimex. We use their strategies before the month that you are preparing to do your exams. You will get your Mark K. lectures. Right? We have all the videos and we have all the PDFs on that, but we will give it to you. You will get access to that after we cover all the learning materials. You have simpleness and cheat sheets as well as videos and notes. And we also use Saunders for whatever topic wasn't covered in UWorld or simple nursing. We get it from Saunders, and you would also get questions from Saunders. Okay? So what are the benefits of doing Nclex on your own? One is the bonus. When you put your money out, they are going to, whatever agency you go to, you're going to go to one that is going to give you a sign-on bonus. If they're not offering a sign-on bonus like in advertising it, you can ask them for one, as well as you can negotiate your rate of pay. So basically the agencies that came down here, they were offering between $34 and $36 an hour. You can get more than that if you have Nclex on your own, right? It gives you the ability to negotiate. You also move at your own pace of study. While we would want you to keep with the program because it's going to benefit you, at least you're not being pressured by an agency to attend classes every day. I know that was one of the challenges I had when I had first signed up with an agency way back in 2016. You had to attend classes, and then if you miss a class, they get in on your case. My classes are recorded and on a YouTube, and you'd have access to it. So if you're at work on the day that the lecture is scheduled, you could always go back and look at the video. It will be accessible to you at any point in time. What are the disadvantages? The cost is your own, right? So basically, you have to have your first 4,500 to start the program. And then within the next month or two, I would advise you to do your 485 US. So basically, that's 500 US, 7535, that's 3,500. The reason I ask you all to do this early is because Nursing Council takes forever to send out your license verification. It can take more than 4 months at times, and you have to keep calling them. And I think the more you call them, the more vindictive they come. There have been instances, it happened to me, and it happened to one of my colleagues who signed up. They sent off their license verification without a stamp or a signature. And I think it's all part of the delay process that they engage in. If they can delay and frustrate us, they will. So basically, now we're going to talk about what Nclex is. So Nclex is a computer adaptive testing exam. What exactly does that mean? So each question that you will are given will determine the difficulty of the next question that is going to come. So if the correct answers will make the next question harder, while an incorrect answer will make it easier. But you don't want an incorrect answer because it takes away from your score, right? So your goal is to achieve or maintain a certain level of difficulty so that the computer, a logarithm, can evaluate your knowledge level. So you don't want to be too smart, but you don't want to be unknowledgeable, right? You want to find a median on the curve. So there are several types of existing questions that was before the Nclex new gen. You had your multiple choice, you select all apply and your hotspots. And the hotspot is basically where they will show you a diagram, like say for instance, the chest with the heart in it, and they would ask you, they would have a labels like A, B, and C, and you would have to put your cursor or type in which part is the pulmonic, you'd had the pulmonic valve or the herbs point, all right? Or they could have any other thing to find out, but that was one of the popular ones. You also have in fill in the blank where they will give you a free text answer and you have to answer. And this will come, for instance, when you're doing a medication calculation. Now, always read if they say to 1 decimal point or a whole number. If they're looking for a whole number and you put in a decimal point, you're going to obviously get it wrong. If they say to 1 decimal point and you put 2, you're going to get it wrong. So you have to remember to round it off. We also have the drag and drop, and this is used when the order is in the correct order. So you would have a column on the right-hand side with a certain amount of information, like say, for instance, what is the order you would put on a sterile glove? And then you would have to put it on the right-hand column according to the order, all right? Then you have your charts or graphic questions, and this will consist of an image as well as a text. Example, a heart rhythm. So they'll give you an ECG rhythm, and you have to say whether it's normal sinus bradycardia, or normal sinus rhythm, or ventricular tach, ventricular fibrillation. All of these things you're going to be learning in the program how to differentiate it. Okay. You also have the graphic answer multiple choice, and this is the same as your normal multiple choice question, but it uses graphics or images as an answer instead of a text. So you pick a picture or you pick an image. You also have the audio video, and this is where you listen to a sound or you watch a video and then you answer a question about it. And one of the sound could be a heart sound or a lung sound, whether it's a ronchi or harsh breath sounds or coarse breath sounds. So we're going to cover all of this in the program as well. Now, one of the reasons that they introduced the new gen Nclex is because they found that a lot of RNs are coming in after the past Nclex and they're still not aware how to treat seriously ill patients. And a lot of the deaths are attributed to inexperience. So they looked over the program and they looked over the how they prepared the nurses in passing Nclex and they designed these programs. So something I forgot to mention, the SATA questions, you select all that applies where you have more than one answer. With that particular type of questions before New Gen, if there were 4 possible answers and you put 3, you're going to get it wrong. You put 5, you're going to get it wrong. But now with New Gen, you get marks for the ones that you do get correct. So one of the strategies is if you're not too sure about an answer for your SATA questions, do not put it. Because if it's 3 possible answers and you put 4, they're going to take away some of the marks. So if you're not absolutely sure that one of the options is an answer, don't choose it. You only get marks for the ones that you get correct and don't lose marks for the ones that was wrongly chosen. So now new generation Nclex, they have it used to be 75 and you had, I think, up to 300 questions. Because of COVID, they had to shorten it. So they put a minimum of 85 questions and a maximum of 150 questions. And you basically have 5 hours in which to do this 150 questions. You can take 2 breaks. However, 15 of these questions are pre-test questions that are not scored. So you can expect between 70 and 135 questions that you do to actually be scored for your exam. Now, the NCLEX test plan, as again, I said they renewed it in 2023. This just states that. And these are the categories of that you are going to be tested on. So you'll see the largest categories would be management of care, where you provide a safe and effective environment. Then you have safety and infection control. And the next one would be pharmacological and parenteral therapies. And they always look to see the side effects. You have to know the side effects, which will be pointed out to you during the lectures. And then physiological adaptation, or maybe some of the part of it is 11 to 7%. The others would be health promotion and maintenance, psychosocial therapy, both of them 6 to 12%, as well as your basic care and comfort. Reduction of risk potential is your next one with between 9 and 15%. Okay, so your questions, when you're getting them, they are based on each one of these categories. So you would know when you analyze your questions, which area you are weak in that particular topic. So basically, when you get your questions, I will go in and I will do a brief survey, and I would see if there's a trend in you not knowing a particular topic. Or say, for instance, if in your SATA, you're choosing a lot of the wrong answers, and I will base it on comments. But basically, the questions that are given to you, when you answer them, you get a response and you go through the rationals and you see it. And when you're doing your questions, have a notebook or a scrap paper and a pencil. And the questions that you're not too sure about and you're making a guess or uneducated a guess, put a star by it. So even if you're rationalizing it, you can see if your rationale was right or wrong. All right, that helps in the process of learning as well. So it's not just doing the questions, it's going through after and looking at the rationales of why you got it right or why you got it wrong. Again, the computer adaptation is different to your traditional pen and paper, where with the pen and paper, the same items is given to every candidate. Right? Everybody, like when you're going to CXC, everybody have the same paper, one with multiple choice. That does not happen in computer adaptive testing. So they give you questions on certain topics. So if you start your exam with an antepartum question and that's your weak spot, and you didn't answer that question, they're going to keep bringing back questions on that for you. You have to pass each section or each topic that they bring to you. You have to pass it or they will not move on from that topic. So like one of my students who came to me, she was a repeater and that was her scenario. She got a lot of maternity questions because that was her weak point. She didn't pass the first time, but she passed the second time when she joined my program. So one of the disadvantage of this is that with the pencil and paper, it is found to be inefficient. All right, so then they move on to the computer adaptive testing, which it tests you on your ability. All right. So not everybody is tested the same way. So as I said before, if you get a question wrong, they're going to bring back a questions to you on similar topic, not the same wording. They'll change up the wording so that it seems easier to you and they will present that to you. If you get that correct, they will step up the difficulty one more up. All right. So another disadvantage of the pen and paper is that guessing can artificially inflate the scores, right? Instead, the Nclex uses the Kato's computer adaptive to administer the items, and it is able to produce the exam results that are more stable using fewer items by targeting items to the candidate's ability. So it doesn't say, like, say, for instance, a fixed exam, you either pass or you fail. They are going to use. So if you're very smart, you're going to get very hard questions. If you're medium range like me, you're going to get easy to hard question depending on how you answer and how much you get correct. So the goal of the CAT is to determine the ability of the candidate in relation to the passing standard. And every time they answer an item, the computer re-estimates your ability. And with each answered item, the ability estimate becomes more precise. So the item is limited to the content area that will produce the best match to the best test plan percentages. And it is ensured that each candidate's exam has enough questions for each content area to match the required test plan percentages. So basically, they're giving you questions in the areas that you can pass your exam to give you the best possible chance to. Now, regarding the clinical judgment items, these are the case studies. Accounts for approximately 10%, and approximately 10% of your standalone items will be selected depending on the exam length. An item or item set is selected when the candidate is expected to find challenging and is based on the candidate's answers up to the point and the difficulty of those answers. So the computer estimates their ability and selects the item or item set that the candidate should have a 50% chance of answering correctly. All right, so this way, the next item or item should not be too easy or too hard, and the examination can get the maximum information about your ability for the item or the item set. It excludes any item or item set that a repeat candidate has seen in a previous exam. So they're begging you to pass the exam. You have a 50% chance of answering the questions that they give you. So they would probably start you off with about 5 standalone questions and then give you a case study based on how you answer it. I've had a lot of people say they get a lot of case studies, and that would be because the first case study they didn't pass it, so they're going to give them a next chance with another case study. Now, if you resit the exam, they have millions of questions. You're never going to see the same questions come twice in your exam. That's basically what number 3 is saying. Now, how do they determine if you pass or fail Nclex? Because there's no definite passing point. It's all about your ability to answer questions. And normally, sometimes it takes more than 25 hours because the computer not too sure. It's going through the questions and weighing how you answer it. So let's go in and see how they evaluate this. So the decision as to whether a candidate passes or fails the NCLEX exam is governed by 3 scenarios, right? One is the 95% confidence rule. In this scenario, is the most common for most of the NCLEX candidates in that the computer will stop giving you questions when it is 95% certain that it's clearly above or below the passing standard. So you get most of your questions correct. Okay, we're gonna pass her, right? You get very low in answering the questions. It's gonna give you a fail, and it might cut off. I've seen in the blogs some persons cut off at 85, and they would have failed. That means they were not answering those questions at all correctly. Scenario 2, you have the maximum length exam, and most candidates' ability levels will be very close to the passing standard. When this is the case, the computer continues to administer the question until you reach the maximum number, which is 150. At this point, the computer would disregard the 95% confidence interval rule and consider the final ability estimate, which is if it's at or above the passing standard, you will pass, and if it is below, you will fail. Then the third rule is if you run out of time, that is, you go beyond your 5 hours. The computer would, if they have not decided that you have passed this exam with a 95% certainty or fail, it will do an alternate rule. So if the candidate has not answered the minimum of 85 questions, you will fail the exam. So if after 5 hours, you've not answered the minimum 85, they will fail you. The computer will fail you. If the candidate has answered the minimum number of items, then the exam is scored using the final ability estimate computed from the responses of all the completed items. So if you reach 120, it's going to do an estimate on 120 questions and see if you pass. So if that final estimate is above, you pass. If it's below, you fail, right? Now, you can pass your exam in as little as 85 questions once you study your material. But if you pass 85, just say to yourself, I'm in the game. I'm still in the game, all right? Now, occasionally, you might receive an item that's been very similar to one that you received before in the exam, in the same exam. So for instance, one of my question was the definition of a hospice. And then they brought it back again for me, like 6 questions down. Now, this could happen for a variety of reasons. One, you probably got it wrong and they're bringing it back for you to see if you know what is a hospice. Or two, they have several items that could be about similar symptoms, diseases, or disorders, but yet address different phases of the nursing process, right? Whether it's an assessment or whether it's a plan or whether it's the evaluation. So you have to read your questions very carefully. Alternatively, it could be a pre-test item, one of the 15 questions that they're test scoring, and it could appear to have similar content similar to the operational or score item. It is incorrect to assume that a second item, which is similar to the content previously administered, is administered because you were given the item incorrectly. They say not to do that. All right. So when I had my exam and I got those two questions, I thought I got the first one wrong. So obviously I chose a different answer. Stick to your answer. Do not assume that it was incorrect, because if it's a test item, we're testing you in different parts of the nursing phase, choose the correct answer. All right. And always select the answer you believe to be correct from each items. All examinations conform to the respective test plan, that is the Nclex or the PRN or the PN. Now, guessing. Rapid guessing could drastically lower your score, your final estimate score, right? So therefore, you should be prepared. So some test preparation companies have realized that certain paper and pencil tests in unanswered items are marked as wrong. And to improve the candidate score, they're running out of time. They just put in, when they tell you in CXC, just color, don't leave any question unanswered. You have a 50% chance of, well, a 25% chance of choosing the right answer. So don't leave any item unscored, just color it. You cannot do that in Nclex. You're going to reduce your estimate and increase your chances of failing and not passing, right? So the best way is to do your practice questions when I send them to you. Give yourself the discipline of mind as well as the stamina to answer questions, because you have 5 hours. You're going to be a bunch of nerves if you do not practice this. But if you practice it while we're doing the program, you become more confident and you become more knowledgeable. You're going to be able to pace yourself. So not that I'm boasting, but I'm just telling you about my experience. So I'm a fast test taker. I am not one of those persons who can mull over a question. I tend to go with my gut instinct. If I take too long on a question, I will start thinking all kind of nonsense and I will change the right answer to the wrong answer. That has been my life experience. So now I stick to my gut instinct. Whatever jumps out to me as being the right answer, I take it first and I go. So I basically finished my exam of 75 questions in less than 2 hours. And I was scared that I would fail because I went through it so fast. I think I was in question number 60 something, and I didn't realize I had reached 60 something, and it was less than an hour, it was about an hour. And I'm thinking, okay, don't worry. I have 300 questions, I'm still in the game. And I think I reached question number 74, and I didn't realize I reached 74 because I was trying to blank that off from my mind. And then I hit 75. And after I answered question 75, my computer closed off on me. So I was a bunch of nerves, if I did the right thing, if I passed or I didn't pass, because it cut off on 75 and it was less than 2 hours. And I didn't take a break. But that is just the type of test taker I am. There was one other girl, she was American, and she came out the room the same time with me. Another American guy, he came out, but he came out on a break. And he told us he reached question 30. But again, everybody is different. You know yourself by now. You know the type of exam taker you are. You know what your strengths are, what are your weaknesses. But basically, during this program, we prep you to answer your question. We build your stamina, we build your knowledge, and you go with the flow. Also, always carefully read and consider each item before answering. We're going to teach you how to look for keywords. When we are doing the classroom, I will go through the questions with you. You basically normally have like 10 to 20 questions depending on the topic. And we look at keywords in the question and keywords in the answer. because one word can make an answer wrong. You know how it is in multiple choice. So in your new generation Nclex question, you have the case scenarios. You normally get 2 to 8 questions in each case scenario, and you're provided with the patient record and several tabs and a split screen. We're going to look at a video about that just now. Then you have the extended select all that apply, which has the longer select all that apply. So you can have up to 6 options sometimes, right? Or up to 8 here. And partial credit will be given to the answers that are correct. Remember, I tell you, do not choose an answer if you're not sure, because you're going to lose a point. You have the drop-down answers. Basically, it's a cross between the multiple choice and fill in the blank, in that you would be given, you'll see a drop box, and when you press on the arrow, you would see like 3 or 4 options. You choose one of the 3 or 4, okay? You have the extended drag and drop. Again, this is the traditional drag and drop, where except that there will be more answers than spaces. So before you would have like 4 columns, well, 4 options on your right-hand side, or 5 options, right? 4 options. And on the, sorry, you'd have 4 options on the left-hand side that you have to choose from, and you would have to put it in the right order on the right-hand side. Now they're going to give you 5 or 6 on the left, and you have to choose the 4 correct one and put it on the right. That's basically what the drag and drop is. You have the highlighted section, so you get a paragraph, and these questions will be answered by highlighting an area of text in a given passage. So say, for instance, they will give you a passage with the admission of a patient. They will give you the vital signs, the signs and symptoms, and then you would have to go in and click on the words that they want. So they would tell you what are the most important vital signs for the patient that the nurse should be aware of. So say, for instance, you have blood pressure 90/40, pulse rate of 128, respiration 16, saturation 92, came in with cold sweating, chest pain, diaphoretic, well, I said cold sweating, and you would have to say which one of those are the ones that you need to pay attention. Obviously, all the things I just mentioned, with a patient with chest pain, you would have to do it because he's hypotensive, 90/40, pulse rate is above 100, saturation is below 95, respiratory rate 16, still within normal for an adult, but he's diaphoretic, so you're going to highlight on that word, as well as the chest pain, right? That's what the highlight text is. Then your matrix grid is similar to the select all that apply, but it would have either select or don't select. So you'll see an example of that as well. And they would have a list of 8 different interventions from which you have to choose if they're anticipated, non-essential, or contraindicated. When you see the video, you'll be at an appreciation what it is. So scoring, so again, the standard questions from all Nclex will continue to be worth 1 point. That will be your multiple choice and your select and apply and your hotspot. However, when you have multiple response questions, they receive the partial scoring. So in the new gen style question, again, the scoring, you have plus or minus scoring, where it lets the test taker earn 1 point for each correct response, but lose 1 point for each incorrect response. That's like in your SATA, right? As well as the drop-down boxes. If this total score is negative, then the final score would be reduced to 0. So say, for instance, a question had 3 points, and and it had 6 options, and you choose, well, say it had 2 possible answers, and there were 6 options, and you choose all 6, you would technically be at a -4, right? But they're not going to be harsh on you and give you a -4. They're just going to make it 0. You just didn't earn any. You all understand that? Everyone understood that point?
Yes, yes, miss.
Yes,
Okay.
miss.
Right, so then you have dyad scoring, where the test takers get 1 point if both answers in a paired set are correct, and triad scoring, if they get 1 point for each correct answer if all 3 are correct, right? The test taker gets 2 points. Okay, we move on. So far, any questions on that? Any questions on the Nclex on exam so far?
No questions, Miss.
Okay, so we move on. So this is basically the next generation from their judge. I'm telling you how they come up with their questions, right? So they use a model called the clinical judgment type model in which to design these new gen items. So they looked at the model, we're going to define the model, and we're going to look at some of the prototypes of questions. So in 2015, they ever so often, Nclex and CSBN, they go in and they evaluate how this exam is being presented, how people are scoring, right? So in 2015, they did an analysis and they saw that education regarding critical thinking, clinical decision-making, and clinical judgment had already become a standard part of nursing curricula. And 50% of nursing errors included novice nurses. 65% of errors to poor clinical judgment was due to poor clinical judgment making, and 20% employers were satisfied with clinical decision-making skills of novice nurses. And the clinical judgment is very important for public safety because you see a lot of the nurses, half of the nurses were creating nursing errors and decision making as well as the nursing skills. So they needed to redesign this exam to prepare the nurse when she passes that she can practice effectively. So basically, the clinical judgment is a necessary skill for the novice nurse, and client care nurse areas can be improved by enhancing their clinical judgment skills. And there's a clear need for direct, extensive, and explicit assessment in this construct for the entry-level nurses, and assessing clinical judgment is a critical component of the overall goal for Nclex, ascertaining minimum competency. So the clinical judgment currently is indirectly tested in a limited manner throughout the integration across the activity statements. So that's why they created these new case scenarios where you can test your clinical judgment. So there are three predominant nursing theory frameworks for assessing clinical judgment, and this would be the intuitive humanistic model by Benner, the dual process reasoning model theory, and the information processing model theory. So basically, the judgment is nursing clinical judgment was difficult to define, so they use all of these models to become the clinical judgment model. So basically, your nursing process is you have your nursing assessment, then you make your nursing diagnosis, you plan, you implement your plan, and you evaluate your plan of action to see if it is effective, non-effective, or it needs to be changed, right? So basically, your clinical judgment is defined as an observed outcome of critical thinking and decision making. It is an iterative process that uses nursing knowledge to observe and assess presenting situation and identify a prioritized client concern and to generate the best possible evidence-based solution in order to deliver safe client care, right? So that's the definition. We're just going into a short video to give you an appreciation what is the clinical judgment model.
The new Fundamentals of Nursing 11th edition has incorporated a clinical judgment model for nursing students to apply in their practices, with the goal of better preparing them to become expert clinicians. Clinical judgment is a conclusion about a patient's needs or health problems that leads to taking or avoiding action, using or modifying standard approaches, or creating new approaches based on a patient's response to care. The process uses nursing knowledge, experience, environmental factors, and critical thinking standards to assess presenting situations, identify a prioritized patient concern, and generate the best possible evidence-based solutions to make the decisions needed to deliver safe patient care. The model demonstrates how clinical judgment evolves from the nurse's application of the nursing process and critical thinking. Even though beginning nursing students are linear learners, the model will promote development of cognitive skills students need to become competent in their practices and improve their ability to make sound clinical judgments. To understand the nursing process, you need to understand how a nurse begins a patient encounter. An expert nurse assumes a patient's care by first reviewing factors in the medical record that are known. Example, an actual or tentative diagnosis, a list of medications prior to medical history. These factors trigger a nurse to consider existing knowledge about the diagnosis and its symptoms, the expected effects of the medications and treatments, and any experience, classroom or real, that adds to that knowledge. Armed with such knowledge, the nurse approaches a patient and performs an assessment. What is known previously and what a nurse learns while conducting the assessment drives a myriad of questions and observations, all aimed at collecting as much information about the individual patient as possible. With each new piece of information, the nurse considers if more data is needed or refined. While assessing the patient, the nurse applies critical thinking. Knowledge about a patient's symptom, for example, pain, directs the nurse to be thorough in understanding the source and nature of the symptom. Previous experience may help the nurse consider a unique way to assess the patient's pain. For example, have the patient cough or turn onto side. The nurse considers if conditions in the environment alter how the patient is reporting information. For example, the comfort of the room. Critical thinking attitudes and standards ensure a thorough coverage of data needed. The nurse will analyze the data from assessment and name the problem. In the form of a nursing diagnosis, a clinical judgment made by a registered nurse to describe a patient's response or vulnerability to health conditions that the nurse is licensed and competent to treat, for example, pain, lack of knowledge regarding surgery, or anxiety. The identification of nursing diagnosis alerts other nurses and healthcare professionals to the patient's nursing care problems, improving communication and consistency in care. Once nursing diagnoses are made, the nurse plans care by prioritizing the diagnoses and planning the interventions and care approaches. Part of planning is also setting expected outcomes for each nursing diagnosis. For example, if a diagnosis is fall risk, an expected and measurable outcome for the patient is, patient will not incur a fall during hospitalization. Here again, critical thinking is applied to the planning step, with the nurse, for example, including any standards of care that are designed to prevent falls. After a plan of care is made, the nurse delivers interventions chosen to minimize or eliminate the patient's nursing diagnoses. In the example of safety, the nurse works in collaboration with a nurse assistant to initiate universal fall precautions, explains to the patient the risks the patient has for falling, and reasons for the precautions. Family members are included to reinforce safety needs. The nurse continually applies critical thinking to individualize any interventions. For example, does a patient require a physical therapy referral for a cane to walk safely? Clinical judgment requires thoughtful reflection about the selection and timing of interventions, frequency, and combinations of interventions most effective. A critical step in the nursing process is evaluation, the determination as to whether a nursing intervention was successful. Did a patient's condition change, improve, or worsen? When the nurse assesses a patient initially, data collected provides a baseline of the patient's clinical condition. During evaluation, the nurse conducts similar assessment measures, for example, reviews fall risks, questions patient's knowledge. After comparing assessment data with evaluation findings, the nurse decides if interventions had an impact. Evaluation determines if nursing diagnoses have resolved or if problems continue and require revision to the plan of care.
Okay, so that's your clinical judgment model, which basically is the nursing, ADPI assessment plan implementation. But we have to take into consideration everything else that we are seeing, the vital signs. What they find was happening is that a lot of people were not able to prioritize care for a client. So say, for instance, a patient with chest pain, they might just put the patient on a bed and not start administering oxygen or cardiac monitoring or anything like that. So with the clinical judgment, it helps you to choose which one is a priority that you need to look forward to look at. So this is just the framework of it. You have different layers, 4 layers. So the first layer is the client need and the clinical decisions, right? So you're going to make a clinical judgment based on the client need. Then you're going to form hypotheses, refine your hypotheses, and then evaluate your hypotheses. So forming a hypothesis by recognizing the cues, analyzing the cues. You're refining it by prioritizing now which one is the main area that I need to attend to keep this patient from dying or getting worse. And you're going to generate your solution. And then your evaluation is when you take your actions, you're going to evaluate your outcomes. These are your environmental factors, right? Client orientation. I'm sorry for the quality of the slide here. And then your layer 4 is your basic nursing process. So you're using all the different layers and you're coming up with your nursing process. You're going to assessment is you recognize your cues and analyze it, right? Analysis. Planning, you're going to prioritize and then generate your solutions. Implement, you're going to take your actions, and then your final evaluation. So this again, layer 3 is where you do your assessment elements. And again, the NGN case will include one item from each of the 6 of the layer 3 targets in the shown order. Additionally, the items are currently being researched that may map to more than one target at a time. For example, a single item might map both take actions and evaluate outcomes. You'll see that in the different types of questions. So again, you recognize your clues, analyze your cues, prioritize your hypothesis, generate your solutions, take action, and evaluate your outcomes. Layer 4, again, this layer provides context for the clinical judgment. The white bubbles correspond to the external factors such as the settings or your resources available. So remember, when she talk about the risk for fall, they talk about the stairs. If the patient has to do stairs, if they wear proper shoes, you wouldn't give them sandals or slippers because of the risk of falling. Also in the environment, like say, for instance, the Alzheimer's patient, they tend to shuffle, so you're not going to nurse them with rugs because they can trip on the rug. So all of those are the environmental. And then the gray bubbles correspond to the internal factors such as the nurse's knowledge and experience. And you would see here your knowledge, your specialty, and experience. So for instance, a midwife would be able to work with antenatal or postpartum patient, but a nurse who's not a midwife would find difficulty there. Similarly, an ICU nurse would be comfortably able to care for a critically ill patient, but not a pediatric nurse, okay? Now, when you're applying the CJ task model, that is the cognitive operations in layer 3, factor condition in layer 4, It just assesses if the student is able to make an appropriate nursing clinical judgment following the cognitive operations through the entire case study. And again, this is a different table listing out the cognitive function, your conditioning, and your expected behaviors. So your cognitive function, you're going to recognize your cues. Conditioning, then you're going to analyze your cues, and recognizing your cues, you're looking at environment, the patient, the medical record, and the time pressures. And then your expected behavior, you must be able to recognize what is normal versus abnormal, recognize your signs and symptoms of the patient, and the history, the time pressure cues, and identify any history that the patient may have. In analyzing the cues, it requires knowledge of the signs and symptoms if it's expected or unexpected for this particular condition. So if you see a patient with right lower abdominal quadrant pain, the first thing you'll start thinking is maybe it could be appendicitis, or even if the patient is pregnant, or you'd have to do a pregnancy test to see if the baby is in the fallopian tubes, right? Then you're going to prioritize your hypotheses. You're going to give vital signs as a resource and add time pressure for context of the vital signs. And this requires prioritization of the condition and addressing the condition that the client is presenting. So say, for instance, a patient is having shortness of breath. You're going to put, the first thing you're going to do is put that patient on oxygen, right? Or at least assess if they didn't give you the vital signs. You have to assess the vital signs. So the first thing you're going to assess is the SpO2. Now, everything goes in according to ADPI. So you have to look at your question. If they did not give you vital signs, your answer should include an assessment. You don't just go do something, you have to assess. So the patient comes into the emergency room and complains of shortness of breath. We're not going to start oxygen because they didn't give us any information about his oxygenation. We don't know that for a fact. So the first thing we're going to do is assess the patient's SpO2. You don't just run and go put in oxygen, right? Suppose the patient has a history of COPD. Giving them a high rate of oxygen is going to be more detrimental to them than helpful. All right, so once you are not given vital signs or anything of an assessment form, and they present you answers, look for an answer that has an assessment component to it. Then you're going to, after prioritizing your hypotheses, which one is most important, you're going to generate your solution. So say, for instance, in that question, the patient is complaining of shortness of breath, and you're going to generate a solution by assessing the vital signs, right? Knowledge of the condition. So, okay, you're going to ask the patient, are they asthmatic, or do they suffer from cardiac conditions? You're going to have knowledge of the treatment for the condition. So say, for instance, the patient say, no, I'm not asthmatic, but I wheeze, I have COPD. So, you know, for a patient who is wheezing, you're going to give them a high flow of oxygen, whereas with COPD, you're not going to give them a high flow of oxygen. That is going to actually diminish their respiratory effort because they need to have carbon dioxide to trigger that respiratory effort. If you give them high concentrated oxygen, you're going to diminish their respiratory effort. So again, you're generating solution based on the condition and the knowledge of the treatment with the conditions. You're going to take action. So based on your experience, you're going to take your action. You're going to put a small amount of oxygen on the COPD patient, like 2 liters, and you're going to evaluate your outcome. Did this make the patient better? Was it comfortable? Did it become less distress? All right. So you're going to follow up with labs, vital signs assessment, and determine if improvement or worsening of the condition was being treated. Any questions on this so far? Okay, so we move on. So we go on to the prototypes of questions. And again, you have the primary way the NGN will measure the clinical is through the use of the case studies. And this would be unfolding scenarios in that they would give you a certain amount of history at a certain time, and then they would tell you X, Y, and Z was done, and they would give you some more time, so an hour after, 2 hours after, and you have to, based on the information they give, answer the questions, right? So you have unfolding scenarios that are common. So it might be an appendicitis, it might be an asthma attack, a chest pain, common conditions. They're not going to give you rare conditions for your case scenario. They rarely ever test rare condition. Nclex likes to test what is going to kill or make the patient worse. All right, because those were the problems they were having with the novice nurses not making correct clinical judgment. So they're not going to test you on rare diseases. They're going to look for common things that can go from bad to worse in 0 to 60 seconds. And each, you have the information on the body, which is the stimulus or the scenario, that's the body of the question, followed by 6 related questions. And each question tests an important element of your clinical judgments. So as you review this sample, you are able to identify the connections to real world and safe and effective care. Now, many of the GN study represent, again, real-world nursing situation, and it measures the ability to identify, analyze, and synthesize the most relevant information that is appropriate to the nursing interventions and is prioritized on the patient's needs. So you have to select and perform correctly and then evaluate for effectiveness. So again, case studies will usually include 6 items, maybe up to 8, and the order of the items will always match the order of the sample set. And some case studies will include multiple tabs of information that you get. In the NGN model, the case studies and associate items reflect nursing situations similar to what the students are seeing in the classrooms and will see in clinical practice. However, they found that it was not enough for the NGN to appear to measure important material, and they worked on more than a decade to get these evidence-based questions. All right, so we're going into some case study questions, some examples.
Hi, I'm Melanie from UWorld. We're looking at next-gen practice questions from the UWorld question banks. Alrighty, so looking at an actual NGN style case study from UWorld here, what I want to start talking about first is the clinical judgment measurement model. It serves as the foundation for all of this NGN new style content. So here we have, this is kind of a mock-up to make it easy to understand what this means, but to really understand it in depth, there's a link over here you can go to the NCSBN website, and they are the ones who created the clinical judgment measurement model from the NCSBN. So here we kind of have a little on the green and blue side on the left. You can see that this is what, and we want to focus on the word measurement here. So they created this to help measure nursing students' clinical judgment. And so that's the basis for the NGN content. Now, if you look over on the right side, you can see that it kind of like follows the nursing process in a way, but the nursing process, of course, is focused on like, what do we do as nurses when we're taking care of patients? Whereas the clinical judgment measurement model is testing how well you can move through these steps in making decisions at the bedside. So starting at the top, recognizing cues just means like, can you notice the stuff that you need to notice to make decisions? Analyzing cues means that like, can you take those pieces and pick out what's important and put it together? Prioritizing hypotheses is taking that information, putting it together, and then deciding what's most important here. Generating solutions is then, what can I do about this? Taking action is, let's do it now. How do I do it? And then evaluating outcomes is, did it work? Should I do something different? And then we kind of just continue in this continuous cycle, just like the nursing process. It goes as just a continual loop of like taking care of your patient is like checking things out, intervening. Did that work over and over again? So it kind of mimics that, but the purpose is different. This is for testing understanding of clinical judgment. So with that in mind, when we look at a case study itself, the idea is that each question in the case study is going to try to hit one of these steps so they can measure how are you doing as a student matching up with each of these steps of the clinical judgment measurement model. Are you hitting each of these? Which is why you can see here that this is a 6-step model and there's 6 questions in a case study. So let me flip over. So the nurse's notes tab here gives us some good information to start with. We can tell they're in the emergency department. It tells us that it's 8 a.m., 800 hours. That may or may not be important. And then we can see here the client has come in due to fear of having a heart attack. Heart attacks, of course, are one of the most emergency conditions you can walk in with. The client states, I was taking a bus from home. We'll just kind of read it over briefly here. Chest tightness, they had some help, and there's some fear here of what happens next time if they can't find help. And then they're saying that they have had some similar experiences recently. It's kind of random, and they're afraid of what's going to happen if it happens again and if they'll have help. So then looking over, of course, we have a lot of clinical data here. So we're going to go from the nurse's notes tab and make sure we're looking at all the information. Here's the history and physical tab. This has a lot of helpful information in it. So these are typically written by your healthcare provider here. And this is going to tell us a lot about their physical symptoms. So generally, we can see that this client, even though we're not looking at them, we can tell from the notes that they are well-groomed, taking care of themselves, but having some minimal eye contact and appearing fidgety, tearful, a flat affect, which is something that can be associated with depression, some other conditions. So definitely maybe some mental health issues here we want to be sensitive to. The client is trembling. The thought process is logical. That's helpful to know. And no reports of suicidal or homicidal ideations. That's great. Definitely something we want to always screen for with mental health concerns. Cardiovascular is important here because they're reporting chest tightness. We've got random episodes of chest pain, some dizziness, which could be, concern for perfusion if they're being dizzy. Shortness of breath, heart palpitations that have been happening and stopping over a few months. Spontaneous resolution of pain. They're having some weight loss, which there's a bunch of different reasons you could have that. Thyroid issues, or just depression, or other mental health stuff. And then we see here they drink alcohol socially, so that's not something that's jumping out to us. The client reports having a glass of wine with the evening meal yesterday. So none of that's really jumping out for psychosocial there. And then just making sure we don't miss anything, here's the vital signs tab. So this patient right now, same time, we can see it's also still 8 a.m. here with this note. Temperature's 99, a little bit elevated, but I wouldn't say they're febrile right now. Getting close to tachycardic here, but could be due to anxiety. Respiratory status is totally fine, 1898 on room air, that's great. Blood pressure is great. So now we kind of have this picture in our head of how they're doing physically and mentally. Let's go over and start looking at the questions. So this is the first of 6. Which of the following findings requires immediate follow-up? And then we select all that apply. One of the nice things about this item is that it's actually a traditional item. You've seen these items before on your tests in nursing school, and as we know, the questions that are inside of a case study can be any item type. They can be some of those newer ones, which are a little intimidating, or they can just be these traditional items that you're used to seeing. So that's kind of nice here, because this is an item that we've seen this before. So let's go through one by one, and we can see here this word immediate is bolded. So we're not talking about like, hey, yeah, we want to make sure that they're going to discharge with this information. We're focusing on what's going on right now. So let's pick out those cues here and see what we find. Select all that apply. So chest tightness, absolutely. That's something we want to follow up on right now. There's some scary things that are related to chest tightness. Flat affect, that's definitely a concern for like a mood disorder, or there's some other neurological disorders that can cause that, but like, is that my primary focus? Maybe not. Heart palpitations, that's another cardiac. When we're thinking ABCs, that's way up there. Minimal eye contact, that also feels like a mental health issue that we definitely want to follow up on, but like right now, it's probably not our highest priority. Shortness of breath, absolutely. ABCs, this could be perfusion, it could be because of a respiratory issue. A lot of reasons that this can be scary. Weight loss, this has been over the first, or I think it's the last couple weeks or some extended amount of time. So this is not our primary concern right now. So go ahead and hit submit. Now, because this is a case study, in our study product, you're not going to see the answers right away, because the answers are the answers to the question and the explanation, because that would just totally give away the next question. So we're going to hold off on that and come back to it, because we definitely want to learn from what we've answered this question with here. So moving on to the next one. So item number 2 of 6, and we're looking over here. It doesn't say that there's new exhibit information, and we can see over here that it's the same 3 as before. Sometimes we'll add a new time interval here to the nurse's notes or the vital signs. They haven't done it on this situation, and if they had done it, they would have told us over here. So we don't need to look at the notes again. We can just focus here on what the item looks like. So one of the newer NGN item types, this is a multiple response matrix item. So going into this question, we know that it's multiple response. So I could go ahead and I could click every single answer, trying to get as many points as I could, but they would knock off points for the incorrect answers. So we want to focus in and make sure we're only clicking the correct answers, because they're going to subtract a point if we select the wrong ones. So looking at it, the best way to think about it really is column by column. So let's just focus. Here we're comparing hyperthyroidism, myocardial infarction, heart attack, and then panic disorder. So let's go one by one, starting with hyperthyroidism. What are the findings that would be associated with that? It says here they may support more than one disease process. So we know that diaphoresis, it doesn't just end up in one of these spots. It could be on all three of them. So diaphoresis, meaning sweating, definitely with hyperthyroidism, they have hot flashes, they have poor, they have more sensitivity to heat and poor ability to cope with the heat. Like if they're outside in the summer or they're just in a situation that's giving them a lot of heat, they don't cope with that very well. Trembling hands, absolutely, that's related to hyperthyroidism because of the hormone imbalances. And then also heart palpitations here absolutely is related to one of the thyroid conditions. Sometimes I feel like I get hung up on hypo versus hyperthyroidism. Hyper here meaning a lot of extra. So they have hyper extra thyroid hormone. And when you have extra, you're more stimulated and you do have heart palpitations. So we want to click that one. And I believe shortness of breath is also that one. I'm kind of, I need to think about that some more. So let's move on to the next column, myocardial infarction. Diaphoresis is absolutely one of those subtle signs that people don't always realize. A little bit of heartburn and some sweating, it feels like, it's kind of random, but maybe not a big deal. But it's actually one of those subtle signs of a heart attack. So absolutely, we want to remember that one and recognize that that's one of the appropriate things to click here with myocardial infarction. Trembling hands, it doesn't feel like particularly characteristic of MI. I'm gonna leave that one off. Heart palpitations, absolutely, this is a cardiac problem. They're gonna feel some flutters and some weird stuff going on. Shortness of breath, absolutely. There's a big issue here with perfusion. When you're having an infarct in your heart, you're not getting that oxygen where it needs to be, and so you're gonna become short of breath. And then thinking about shortness of breath here, absolutely that's related. When you're having an infarct in your myocardial tissue, you're not getting perfusion to your heart's not working like it's supposed to be, the blood's not moving forward as well as it's supposed to be. And so absolutely shortness of breath is something that you could see with that, and it's definitely one you want to follow up on. All right, and then panic disorder. So this is more a mental health issue. And so the physiological stuff going on is more related to how these hormones our body is releasing, like adrenaline, how it's affecting us. So it doesn't mean that, shortness of breath, I would absolutely say is related. Does that mean we're having a respiratory problem? No, but we're having a situation where our body is saying like, oh, it's time to panic. It's time to go. Something needs to happen. We're short of breath because our body's getting ready to do something because we're feeling that anxiety of panic. Heart palpitations also definitely related to panic disorder. With the flood of stress hormones you're having, a lot of people do report chest discomfort. So they'll have that feeling of like flip-flopping in their chest, and that, we call that heart palpitations. Also diaphoresis, again, similar or related to the same thing. You're going to see some sweating. So that would be related as well. Trembling, I think that's related. You're feeling really freaked out and people get trembly when that happens. Okay, so then let me just double check what we're missing here. This one's empty. I think that's okay. And then hyperthyroidism, this one's empty. I feel like they might be short of breath, especially because we know that with temperature dysregulation and they do have elevated temperature, shortness of breath is sometimes this thing the body does to kind of compensate for that. So kind of releasing more air, breathing faster, they may feel like short of breath. So I feel like we could click that one and see how we go. So let's go ahead and submit. And again, we won't see the explanation just yet. So we'll move on to the third question. A lot to think about with this. All right, item 3 out of 6, and we can see here that something else has popped up, and then also it tells us right here, the nurse has reviewed the information from diagnostic results and laboratory results. So we want to make sure we're checking out those tabs again. So coming over here, we've got laboratory results, and as we know, troponin is one of the hallmark labs that tells us whether or not somebody's having a heart attack. So here with troponin, it looks like they've tested 2 different types. I don't know exactly the difference, but I know that troponin is a test they do to tell me whether or not they're having an acute myocardial infarction situation. So I can see here they do give me the reference ranges. So I know that a troponin value here of more than this is going to be concerning because the normal value is less than 0.1. So anything that's above that would be concerning. This person's value is 0.0. So the normal being less than 0.1, we're in that safe range. We've got a normal value for this troponin. And then the same here, they're at 0, the normal is less than 0.03. So I feel like we're really ruling out here heart attack is the cause of this person's symptoms. So again, we're going through the clinical judgment measurement model, we've analyzed the cues, and now we're kind of prioritizing like what is going on and what do we do here? And then we need to also make sure we look at the diagnostic results. So looking at diagnostic results here, the ECG is showing that they're in sinus tachycardia. We already knew they were in tachycardia. We looked at their vital signs and their heart rate was elevated. So, and this is not one of those findings like there's certain, ST segment elevation and other arrhythmia findings that would tell the provider that there's a potential for a heart attack here. And they're really the ones to look at that and make decisions most of the time. But here we know at least that this is something we already knew was going on, and it's not one of those hallmark scary arrhythmias that make us think heart attack. So we've kind of ruled out heart attack, which is great. All right, moving over to look at item 3 here. It's asking us to complete the following sentence by choosing from the list of options. So the nurse recognizes that the client is at highest risk. So again, we have that bolded word and highest telling us that this is the most one we want to focus on. It's a priority here. That doesn't mean that the other ones aren't potential answers, but we're focusing on the most important here, which makes sense because this is the prioritizing hypotheses question in our clinical judgment measurement model. So highest risk for developing blank as evidenced by blank. So here, let's look at our options and see what we can pick from. So we think they're at highest risk of heart failure, agoraphobia, or thyroid storm. Here with this patient, I think from everything we've read in their history and physical especially, I feel like we're leaning towards a mental health issue with their affect, and then they're not reporting a lot of GI distress that people can have with thyroid issues, like especially, bad hyperthyroidism. So I think we can kind of rule out the heart failure because we already know it's not cardiac. And I think we can go away from the thyroid issue right now. And I think we're going to focus on the mental health condition. So here I would say the most related mental health condition here is agoraphobia. So I think that's going to be our answer for what they're at highest risk for, because they're having those panics in situations, and it seems to be they're on a bus when it happens, so maybe it's related to being around people. So let's click that as our concern for like a complication or a future problem they may develop. And then as evidenced by blank. So let's see what our options are here. Fear of future attacks, they absolutely have that. We saw that. And then evidenced by chest pain and palpitations. Well, that's definitely related to panic attacks. But if we're trying to support our answer of agoraphobia, that may not be the best. And then here, recent weight loss and loss of appetite. So again, with this type of question, our first blank has been answered, and so the second blank is needing to support what we've answered in the first blank. So we really need to focus on this wording as evidenced by blank. So really what tells us that agoraphobia is going to be the answer? And that I feel like is fear of future attacks, because when you get around a group and you have that anxiety, I think is characteristic of agoraphobia. So I think we're going to go ahead and click fear of future attacks because it seems most related. All right, and again, we'll come back for the explanation here. So moving on, we got question number 4, so we're over halfway there, and we're moving on in the measurement model to the stage of generating solutions now. And then we have this little alert here again that says the nurse has reviewed the information from nurse's notes. So we know they've added more information. There's not a new tab here, but if we scroll down on the nurse's notes, we can see there's a new time frame. So it was 8 a.m. and now it's 9 a.m., an hour later. We're evaluating the client. They look irritable, fidgety, restless, still organized and logical thought process. Anxiety is 6 on a scale of 0 to 10. And then we're giving them a benzo to help with anxiety. So this alprazolam is one of the benzodiazepines. So that's going to help with anxiety. So we're going to go ahead and give them that medication here. And then other solutions we can provide. That's what we want to focus on with this question. What else can we do to help this client right now? So here we're going to say for each potential intervention, click the intervention as indicated or contraindicated. So this is again a matrix item, but it's a multiple choice matrix, which means that there's one answer for every row. So they're telling us, give us one answer in every single row, which helps us understand that they're not going to take away points if we click the wrong option, because they're telling us you need to put an answer at every row. So this is one of those where they give you points for every right answer, but they don't take away points because they've already said, we want 5 answers, so give us 5 answers, please. So just kind of think about that as we go through here. So one potential intervention is encouraging the use of positive self-talk. I think that's appropriate. This person, again, if they're having some mental health issues, could benefit from that. I think a lot of people can benefit from that. So I would say that that's indicated. So we would click this column. And I think it's helpful to kind of treat each row as a separate question here. So then we're going to go on to the next one, and it says, ask the client about any recent life stressors. So is it good to bring it up right now? Is it therapeutic to talk about that? I think generally when we read about therapeutic communication, we want to help the client open up about this kind of thing. So I think it's probably indicated. We'll click that. Assist the client to recognize physical symptoms of anxiety. This is absolutely helpful because here we've given a benzodiazepine. If they walk away with a prescription for that medication, they're going to need to know when to take it. So having them understand, like, what is it that's like a precursor, a sign that this may be coming, a panic attack. Can we recognize those signs? So this is really important. I think a great nursing driven intervention here is we want to make sure they can understand when if this happens again. Encouraging the client to spend some time alone when feeling anxious. Oof, that one's tricky. Should they be alone when they're anxious? If we're considering agoraphobia, that one's kind of difficult. I don't think we want to do that. I think we want to encourage support systems is what we usually read about in our nursing textbooks. But then again, if they're going to be agoraphobic, I'm not sure about that one. I think being alone can be relaxed. Let's click indicated. Not sure. And then reinforcing abdominal breathing exercises to use for anxiety. That's very much something that's appropriate for most people. So this is a great situation to use that intervention, which I think is why it's an important option here, because this is something they can do when they're feeling that panic coming on and the medication maybe isn't available or they haven't taken it. And this is something they could sit down and do. And if we teach them this, then it can help them in the future. So I would say that's absolutely something we want to do. So we answered all 5 rows. Perfect. Move on to the next one. All right, item number 5 of 6, we're getting close. It says the nurse reviews information from nurse's notes and vital signs. So we know we've got some more information to look at. Let's scroll down further on the nurse's notes. It says here, a couple hours later, the client rates anxiety as 2 on a scale of 0 to 10. That's great. So we've come down from a 6 to a 2. And they want to go home. They're ready to go home. The client is referred to an outpatient mental health clinic for follow-up. That's perfect, because it is the nurse's job, absolutely, to make sure that we're not just, hey, here's a Band-Aid, now you can go home. We want to make sure that this chronic condition is going to be carried through with further treatment. So we want to make sure, hey, do you have the phone number for the clinic you need to go with? Do you have an appointment set up yet? This is something, when you're discharging a patient, this is the nurse's job. You need to make sure that this is happening. So here we say the client is referred to the clinic. Perfect. We can check that box. And then our other new information that we got here was under the vital signs. So we can compare the 8 a.m. vitals to the 11 a.m. vitals and see that with the anxiety going down, things have really normalized here. The respirations have gone down. They're still satting really well. Everything else is getting much more normalized, which is great, which is another good indication that they are getting close to ready to discharge. All right, so looking at the item here, we're saying the nurse is reinforcing teaching about newly prescribed medications. So we've got alprazolam, which is again that benzodiazepine, which helps acutely with anxiety. So you take that when you're really feeling the symptoms. And then sertraline, which is going to be a long-term medication that you take scheduled at the closest time possible every day to reach a steady state of that medication in your bloodstream. It's an SSRI. So it's an antidepressant. It's going to help with depression, anxiety. So we've got 2 new medications. They're similar in the category of treating mental health, similar in that way, but they're taken very differently. So we need to say here, we need to read here, which of the following statements by the nurse are appropriate to include in the teaching? So what do we say to our patient here to make sure they understand? Select all that apply. Again, this is one of the older item types, so that's helpful because it's not one of the newer, more intimidating ones. For option 1 here, it's saying avoid driving after taking alprazolam. That's a great thing to teach about. It is definitely a nursing intervention because it's very safety focused. If you take a benzodiazepine and then get behind the wheel, there's this risk of that sedative side effect causing an accident. They usually talk on the prescription bottle as well. They say, don't drive or operate heavy machinery when you're taking this medication because it's dangerous. So this is something we want to drill in and make sure they understand that if you take this medication for your anxiety, it could make you sleepy, and then it could be dangerous to drive a car. So we're going to click that one. And then contact your healthcare provider immediately if you experience suicidal thoughts. This is very important. As we all know, when you first start taking an antidepressant, you can quickly get to this period of kind of euphoric, you're feeling more energy, you're feeling better, which is great. But if you're still kind of depressed, this can lead you to have more energy to act on a potentially suicidal action. So here, and this is particularly relevant in the younger group of people, that's when they see it more. So this patient's 21. So this is something we absolutely want to make sure gets across, is that you're taking a new SSRI, there's this potential for this, very devastating complication here. So we want to drive home that, hey, if you're starting to have those suicidal thoughts which happens kind of in that initiation period of taking the medication, contact your healthcare provider because that's not normal. It's not a long-term side effect of the medication. So they really need to know that right now to look out for that. So we definitely want to cover that with this patient. Do not abruptly stop taking alprazolam because you may experience withdrawal. That one is true. That one I'm less confident on. Let's click it. Limit alcoholic beverages to no more than 1 drink a day while taking alprazolam. That one's a little tricky because I think they're not supposed to drink at all when they take alprazolam. But limiting is good if it's a concern because both alcohol and this benzodiazepine are going to be sedating, which is why we're concerned about it. I'm not going to click it because I'm wondering if they shouldn't have any. So instead of 1, it should be none. So I'll leave that one off for now, but I'm kind of hung up on it. We'll see. And then option number 5, take sertraline at the onset of a panic attack. That's wrong. We know that SSRIs, like I said, they need to be taken at the same time every single day because they help prevent. So taking this, you may be taking too much of it, which can cause complications if you're taking it right at the onset of a panic attack. So that's incorrect teaching for this. So we're definitely going to leave that one off because I feel pretty confident that's wrong. So looking back, we've got 3 selected. This is a multiple response. It doesn't tell us how many to click, which means that if we get an option wrong, they're going to count off a point. So I really want to be careful here. Limit alcoholic beverages. Since I'm on the fence, I'm not going to click it because I don't want to lose a point. All right, submit. All right, moving on to the last question here in our case study. It doesn't say we've gotten any new information. I don't see any new tabs over there. So I think we're looking at a future time interval. So the client returns to the mental health clinic for a 1-month follow-up visit, which is great because I love it when we can also see what is this looking like long-term? Which client statement would indicate that the client requires additional therapy to cope with panic disorder? So this is a single best question, so there's only one right answer, which is really helpful. Let's read here. I realize that my panic attacks are under control. I'll eventually need to be tapered off. I purchased a watch that alerts me when my heart or respiratory rate increases, so I can begin breathing exercises. That sounds like good. I'd say they don't need additional therapy if they're doing this. That sounds like something they should be doing. It's probably helpful. My support group has been helping to identify when my thoughts are not realistic, so I can talk myself out of feeling the panic. That's really helpful. I mean, having someone else help you realize when you're spiraling is great. So I don't think that needs additional therapy. I think that's great. I think that maybe they're doing well. Taking the bus has been a trigger for me, so my boss is letting me work from home. While that may not be their ideal, we don't want them to necessarily have to sequester themselves at home because of their medical condition. So that may mean that there's opportunity for them to progress more. I mean, it's great that their boss is being flexible, but is that what they want long term? Taking the bus. This is kind of one to mull over a little bit. Trigger for me. Yeah, they're having to request accommodations from their job because their mental health condition is holding them back. So I would say that this is something that maybe they could progress with. So I think that's the right answer. We'll go with that. So we'll submit, and then we can finally see the explanations, which is great. Let's go ahead and move backwards though, because this is item 6 of 6, and we want to see all the explanations. For UWorld, we have them, of course, for every single question. So we can go back a little bit and see, here's the explanation for this. So we'll talk through why every single option is right and wrong. We got scored 3 out of 3. That's great, because this is one of those where we could have gotten points knocked off and we didn't, which is awesome. If you want to know more, you can click this little thing, scoring rule. There's a little infographic about how that works. We did great for this one. For our multiple response matrix, I think we got them all right. And this is another one where you could have gotten points knocked off. So there's that same scoring rule information there. And it tells us 11 out of 11, we got the max points, which is great. Item number 3, again, both right. This is a 0-1, which means that because they told us we had to have 2 responses, they weren't going to take away points, but we got both points, which is great. Another matrix. Okay, this one I think we hovered over for a bit. It is, let's see. So this was wrong. So the correct answer was contraindicated. Okay, so they're not supposed to be alone when they're feeling anxious. They're supposed to reach out for a support system. So, but they told us we had to have one answer for every row. So they're not going to take away points, which means that we got 4 out of 5. So 1, 2, 3, 4, and they didn't subtract a point even though we got that one wrong. So 4 out of 5, that's great. And then number 5 here, another SATA, we got 3 out of 3, which is great. So overall, we did pretty good for this case study. And then when you are studying and taking your time, obviously we want to highly encourage you to go through and read. Even if you got the answer right, why? Like understanding the why behind the correct and the incorrect options is really that learning opportunity here. So as you work through these, I would definitely encourage you to start again from item number 1 and read your explanations, because that's where the learning is really going to be reinforced. And that's it for this case study. Whether you're taking the current Nclex Hi, I'm Melanie from UWorld. We're looking at
Okay, so that's the end of the video. Basically, that is what the case study looks like. This is a video on the bow tie. Let me see how long. It's 14 minutes long. I can always send you the link for this video so you'll be familiar with the type of questions that they have. Okay, do you all have any questions so far? So the starting date, the tuition start date is for March 2024. A day of the week is to be selected. I would probably put up a poll again to see which of the days is more convenient to the majority of the group, and we will go with that. All right. Your potential exam date, if we start in March, will be between November and December 2024. All right, these are just a link where you can get some more information on it. All right, so that brings an end to our orientation. Do you all have any questions?
Hi, Miss. Was just with the examination or possible examination date, but I saw the information there, so no questions.
Okay. Now you could go beyond that, but that is the date I would like everybody to write their exam because we're going to be doing that 1 month of questions with you all. Okay. And you can go anywhere. If you don't have a US visa, you could go to Puerto Rico. Somebody went to Brazil, I heard. You could go to England and do it wherever there's a Pearson VUE, right? If you sign up for New Mexico board, you could go anywhere in the States and write the exam. You are registered with New Mexico, and then when the agency picks you up, you could apply for compact state license. Once they're applying for your social security number, you can apply for compact state license.
One more question, Miss. The possible 1 month revision will be what month? Like October?
November, yeah. October,
Okay.
November. All right. So if you want to have an enjoyable Christmas, do it before. Nobody wants to be studying for Christmas. Any more questions? Any more concerns? Okay, so we call it a night. You all could always message me or call me if you have any questions or concerns. All right, so I will download the video. It takes a while to download, and then I will post this actual video on the chat for those of you who missed the video. But all other videos will be posted on a YouTube link. So should you continue with the program, you have to share your email addresses with me. As I told you before, people reported some of the videos maliciously because everything is referenced properly. Somebody just was wicked. So you all would have access to your lesson videos. Okay? So take care. Good night. You can PM me. I will put up the banking information. As I said, all fees have to be paid before the 4,500 because in the past people were not honest and I have to keep chasing people for the money. It's quite time consuming. So fees are payable upfront. It should be paid by the last day in February, and I will give you a date, a poll with the date of the week, the day of the week that we're going to have class. More than likely, it might be like a Saturday or a Tuesday. All right, or maybe a Tuesday. I know everybody works shifts, so again, the class is going to be recorded and posted on the YouTube chat. So if you can't attend class, you can at least look at the videos, and then the link of the questions is going to be sent to you. The portal will be open for 1 week for you to do the questions. So like if you get it on a Tuesday, you have until Tuesday, 6 p.m. of the next week to submit your questions, right? Your answers to the questions. If you have problems and you were sick or something came up and you need a little extension on the time, let me know. I will open up the portal for you a little bit longer. But keep in communication with me so I know what is happening to you. Of course, I'm not going to batter you. We are all adult learners, but it's going to be in your interest to do your questions when it's sent to you. Okay, so good night, everyone, and thank you for joining into this orientation. Bye.
Thank you. Good night. Good night.